Well, hello. Welcome to the Mind, Heart, and Spirit podcast, where we talk about all things mental health. I'm your host, Shoyinka. I am a triple board certified psychiatrist, former chief medical officer, physician executive, and in private practice in the greater Philadelphia area. It's my pleasure to welcome you to today's episode where we'll be discussing the basics of mental health. So, one of the biggest questions that people have about psychiatry and mental health in general is a basic understanding of this very important topic because, the truth is there's no health without mental health. Without mental health, a person simply is not able to either function in society or to actualize themselves to really fulfill all the things that they're capable of. And so it's so important to understand what mental health is. So let's start from the very basics. What's the difference between mental health and mental illness? Well, mental health is a state where a person can live life, deal with the normal stresses of life, manage them, and fulfill the expected roles for their stage of life and development. So if they're an adult, that would mean to be able to work, to maintain relationships, perhaps sustain a family, provide for family, and so on. Be a friend and take care of themselves. And for a child, that would be, depending on their stage of development, be able to play with other kids, learn, and have fun. All the things that children should do. So that's basically what mental health means in a nutshell. Now, mental illness is a situation where a person experiences a disturbance in either their ability to think or in their feelings, that's the emotions, or their ability to learn, or in their behavior, or sometimes also in their perception. That's the way they perceive the world around them through their senses. And these conditions are classified in many different ways. They're the most common classification systems. So some of the best known classification systems today include the DSM-5, that's a diagnostic and statistical manual, which is produced in the United States, and then the ICD-10, which closely reflects the same sort of classification system that is in use in much of the rest of the world and in the United States. So mental health conditions can fall into different categories. Some common ways are mood disorders. So that would include things like depression, major depression, or dysthymia, or bipolar disorder, conditions that primarily impact the way a person feels, that their mood states. Then we have all the disorders that impact a person's cognition. They would be termed neurocognitive disorders. So they are things that impact a person's ability to think or remember or learn or organize themselves. And as I say this, I think it's important to realize that many of these conditions they have symptoms that fall into many different categories, the cross-sectional, if you will. Those would be things like the disorders of thinking, primarily would be things like dementia. That is things like Alzheimer's, vascular dementia, Lewy body dementia, and so on. And then you have other conditions that primarily manifest early in childhood. So developmental conditions like autism. And you have other conditions like specific kinds of learning disorders, and you have other types of intellectual disability disorder. And then you have disorders of expression, where a person or a child, usually a child, is not able to communicate properly. And then we have disorders that impact a person's sort of global functioning, like schizophrenia, which is the archetypal psychiatric disorder that many people think about when they think about psychiatry or mental health, is a person whose thinking and feelings and perceptions and ability to organize their lives are all affected by this heterogeneous family of conditions that basically affects all of those things. And then we have substance use disorders, which often basically are a chemical or behavioral addiction. That is, a person loses the ability to control their use of a certain substance or to engage in a certain behavior. Common addictions or substance use disorder would be things like alcohol use disorder, tobacco use disorder, opioid use disorder, stimulant use disorder, many types, and so on. And behavioral addictions would be things like pornography, which is so widespread nowadays, and gambling, which is increasingly an issue also around the world. This is not an exhaustive discussion of the ways to think about and classify mental health conditions. Oh yeah, and their anxiety states. Anxiety states are extremely common. They're the single most common category of mental health conditions across the world. And they include things like social anxiety or general anxiety or panic disorder or specific anxiety states that impacts people's ability to do things like go out in public or be in open spaces, or fear of heights or fear of public speaking or fear of flying or fear of certain kinds of animals, fear of certain kinds of bodily fluids like blood, for example. Again, this is not an exhaustive discussion of mental conditions. It's really intended to help to broaden our view on how to distinguish between mental health and mental illnesses. Now, for today, I think we'll just start with focusing on a big question that many people have, which is how do these conditions even come about? Now, it's important to juxtapose our common, current, more modern, science informed understanding of mental health conditions with how they used to be thought of. So, obviously, mental health conditions have existed all through human history and always affected a subsection of humanity. And right now, the figure is around 1 billion people. That's around 1 in 7 people around the world experiences a mental condition today. Very common. And so it's very likely that you, the listener, know at least one person or maybe multiple people who experience one of these conditions. Now, in the past, it was very hard to understand how mental health conditions came about. And if you think about a world where there's really no science or very little science, very little understanding of biology and very little understanding of physiology and psychology, and really even not an understanding of some things that we take for granted nowadays, germ theory and imaging and all the wonderful things that we have available to us now. One can understand how it was very easy to attribute mental health conditions, which sometimes show up out of the blue without any warning. It was very easy to attribute them to spiritual causes or just bad luck, or somebody was touched by the gods, or they were possessed by spirits, or they were being spiritually attacked, or they were a bad person, they were being punished for their sins, or they didn't have enough faith, or any one of these very strongly held traditional beliefs, still held in most parts of the world to some extent or other. So, for a long time, the result of this was that people that manifested behaviors that suggested a mental condition were treated differently. In some cultures, they were treated with reverence, actually, as one that was touched by the gods, so to speak. In most cultures, however, they were treated with a mixture of disdain or fear or persecution or ostracization. In some cultures, they were even abused and killed. And you still see that prevalent in many parts of the world. People with mental health conditions, including the developed parts of the world, are subjected to treatment that would not be considered humane or would not be considered fit to apply to anybody else. And this is a result, and the persistence, I would say, of these attitudes is really a result of stigma. And stigma stems from a lack of understanding and a lack of awareness, not truly having knowledge or information about how things come about or how things develop. Therefore, feeling that it's justified in some way to act the way we do towards certain things or certain people. So that's sort of the traditional, the historical context. People with mental illness were possessed by demons. People with mental illness were reaping the just rewards or just deserts of their sins or their ill behavior, or maybe those of their family, their forebears, their parents, grandparents, other family, or maybe they were struck by a curse, or maybe they were just bad people who deserved what they got, or maybe it was misfortune, something that nobody could understand. But now we have access to decades, even centuries of knowledge. That is, discoveries that have slowly accrued and accumulated over generations that help us to understand better where these conditions come from. And we're helped by the marvels of modern technology, medical technology, scientific technology, things like basic blood tests, things like understanding human physiology, the flow of hormones through a person's body and how they can become deranged and how they can change a person's thinking and mood and feelings and behavior. We now have access to imaging, so we can look inside a person's brain, which was not possible even a few decades ago. We can even look at a person's brain as they're awake and track the function of different parts of the brain through things like functional MRI or SPECT imaging and so on, PET scans. We have a deeper understanding of pharmacology. We know how certain medication or drugs, whether they're prescription medications or illicit drugs, we can now tell how they impact a person's thinking and feelings and emotions and behavior. And we also now increasingly have an awareness of genetics. We know how a person's own DNA, what they inherit from their forebears, can manifest as mental conditions. We know about nutrition and how deficiency states or sometimes different kinds of food can really impact our thinking and feelings and behavior. So we have a lot of knowledge now that we didn't have before. So let's break that down. Probably easiest to think about mental health conditions when we think about causality, when we think about where they come from. A common framework that is used in learning these things is what's called the biopsychosocial model or the biopsychosocial framework. What does this mean? It basically means that this is to some extent arbitrary, but there's basis for this. Basically, can look at how these conditions develop through the lens of biology, which is how the physical aspects of our being, our bodies, and everything they contain and everything they interact with. We can think of psychology, so that is the way our minds are set up and the way they work. And we can think about social, that is the world we live in and how we interact and interface with the world around us and the effects that it can have on us, whether it's directly in the form of challenging circumstances that people have to deal with, or whether it's through indirect forms like the effect of poverty or war or conflict and so on. So we'll stop there for today, but I hope that this gives people an overview, a brief introduction into mental health conditions and how they come about. Stay tuned for the next episode.